Assalamu alaikum wa rahmatullahi wa barakatuhu. I'm Miss Ulfat Amin, PG Pediatric Nursing, Diploma in Nursing Administration. And today I'm with part third of previous video, that is nursing theories. And in this video, I will be discussing Nightingale's environment theory. If we talk about background of the theorist, Florence Nightingale was born on 12th May 1820 in Florence, Italy. Popularly, she is known the Lady with the Lamp. She started her nursing training in 1851 in Kassereth in Germany. And during Crimean War, she reduced mortality from 47.7% to 2.2%. If we talk about this war, it was fought on 16 October 1853 up to March 30th 1856 for almost 2 years, 5 months and 14 days. Its location was Crimean Peninsula, Black Sea, Balta Sea, White Sea, Caucasus, and Far East, with a huge amount of casualties and losses. And during the same war, Florence Nightingale gained worldwide attention for promoting, for pioneering modern nursing while treating the wounded soldiers. And she reduced the mortality of soldiers from 47.7 to 2.2% in the same war because of her interventions in the and she started the school of nursing at St Thomas Hospital, King's College in London. She's founder of modern nursing and is considered the first nurse theorist. Her books are like Notes on Nursing, what it is and what it is not, in 1860, Notes on Hospitals in 1863, and Sick Nursing and Health Nursing in 1893. She died on 13 August 1910 in London. Now, if we talk about her theory, a core concept of her theory was total environment around the patient. Her main focus was to control the environment of individuals, families, both in health as well as in sickness. As per her concept, environment is viewed as a factor which influences the individual's life, development, and also contribute to the disease or to the prevention of the diseases. She discussed three types of environments. First one is the physical environment, which includes elements like, first is ventilation and warmth. It's responsibility of a nurse to keep patient's room warm, well ventilated and free from odors, keep the air as pure as the air is without the noxious smells or different kinds of the odors. It's responsibility of nurse to maintain air in the room fresh and without lowering the temperature of the room. Next is the cleanliness, pure air, pure water, efficient drainage. So it's responsibility of a nurse to assess room for dampness, darkness, dust, and keep the environment of the patient clean, keep the patient clean and dry, and do frequent assessments of client in order to maintain the patient's skin integrity, in order to maintain the purity of air, purity of water, and effective and efficient drainage of the system or the environment where the patient is living. Next is the adequate light. So as a nurse, she has to assess room for adequate light. She has to make sure that sunlight works best in this environment. So we can say it's a responsibility of nurse to arrange an environment for the patient in such a way that it should be up to the appropriate level for the gradual restoration of health of the client. Next is the psychological environment. If we talk about the psychological environment, it can be affected by a negative physical environment. So we say if the physical environment is not good, like if there is not pure air, if there is not adequate ventilation or warmth, it can affect the psychological well-being of the person, and it can cause stress. So it requires various activities to keep the mind active. It involves communication with the client, about the client and about the other people that are around the client. So it's responsibility of a nurse to give answers to the patient's queries, patient's questions, and to give variety of activities to the client in order to keep his mind busy and away from the stress. Give suggestions which will help in problem solving on incidental basis. Next is the social environment. Social environment includes environment like home or hospital room, or we can say the total community that affects the patient's health, or that affects the patient's well-being. That's the total social environment. Now, if we talk about a meta paradigm of nursing, according to Nightingale's theory, there are four meta paradigms. First one is the person. Person is the recipient of the nursing care. Person is the person who is acted upon by the nurse, or to whom nurse is giving care, or the person is the one that's affected by the environment. So if we talk about what is environment as per Florence Nightingale, can be external as well as internal. Environment includes physical environment, psychological environment, or social environment. Poor or difficulty environment can lead to poor health, or we can say to the various kinds of the diseases, and good environment can lead to the prevention of the diseases. Environment could be altered to improve conditions so that the natural laws would allow healing to occur. Next is the health. For Nightingale, health is not only to be well, but to be able to use every power we have. Maintaining a well-being by using person's powers, maintained by control of environment, and to be healthy. And nursing, as per Nightingale, is above all services to God in the relief of the man, or we can say provide fresh air, warmth, cleanliness, ventilation, and store to facilitate person's well-being. Or we can say nursing is different from medicine, and the goal of nursing is to place the patient in the best possible condition for nature to act, or it's those activities that promote health which occur in any caregiving situation. Now we will see how to apply this Nightingale's theory in a nursing process. First is the nursing first phase of this nursing process is the assessment phase. तो assessment phase में पहले क्या होता है? First is the subjective data. We take information from the client's point of the view. For example, client हमें complaint करता है lack of sleep, and then objective data is the measurable or observable data by science, by physical examination, by diagnostic tests, or by laboratory investigations. तो हमें लगेगा patient is having dark circles, drowsiness, irritability, ये चीज़ें हमें depict करती है he is having lack of sleep. Then we will frame the nursing diagnosis as per the Nanda diagnosis, like disturbed sleep pattern related to disease condition. And now goal, what will be the goal of the nurse? Client will have enough rest and sleep. And next is the nursing intervention, like keep environment quiet by reducing noise, perform nursing procedures before patient went to sleep, like to have a relaxed or comfortable environment for the patient for his sleep, reduce disturbances in order to have a sound sleep. Keep light dim in the room so that the patient gets minimum disturbances. Now what will the nurse do? Did she changes or manipulates the environment to facilitate a good or sound sleep? Then you will evaluate this nursing intervention. What will we get? Goal met. Patient had adequate undisturbed sleep or good rest. So this way you people can link different theories with nursing process. Thank you so much. This was all about this topic. See you with the next topic. Allah Hafiz.